Authors of a new published study show there's a very high prevalence of non-optimally controlled traditional risk factors at the onset of heart disease. What I think it should be called is new study shows that you have nearly a zero risk of a heart attack if you lack these 4 risk factors. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, please like, share, and follow. Now, if you have none of these traditional risk factors, the chance of you having a coronary heart disease event, including fatal and non-fatal heart attacks, heart failure, stroke, and myocardial infarction, is less than 1%, almost zero in about 15 years, according to a new study published in the Journal of American College of Cardiology that found that over 99% of patients studied, mostly from a Korean database and a few from the US, had at least one risk. But what are those risks? That's important. Now remember, some people discussing this are using the usual scare tactics to get interest in their story. It remains not very likely, listen carefully, if you have a risk factor, that you're going to have a heart attack, with lots of people out there with 1 or 2 risks that will never have an MI. And we should only use this, in my opinion, to provide those with no risk factors a sense of great safety and encourage others to modify their risks. Now let's look at these risk factors. You'll be quite surprised, which includes anyone with a blood pressure over 120 systolic or 80 diastolic. 122 is a risk factor. High cholesterol of 200, which many of you have. High blood sugar, even if you're not a diabetic, with one fasting sugar of more than 100, and if you ever smoked. Now, most participants with disease had multiple risk factors, and the number 1 risk factor was that slightly elevated blood pressure. But I ask you, is this a bit of scare tactics as well? With the majority of adult Americans, especially over the age of 65, having a blood pressure well over 120 or a high cholesterol. And while the authors state this is a binational study, the reality here is, listen to this, 9,341,000 participants were Korean. 9,341,000, 6,800 were American. So here's my take home. Great to make news if there are a few people out there that don't have any of those risk factors. And again, if you have a blood pressure of 122, guess what? You have a risk factor. But it's great. You're almost Teflon, and it's very unlikely you're going to have a cardiac event in 15 or so years. But for the majority of folks listening here, like always, try and reduce your risk, get the blood pressure down, and which is the biggest risk of the study. The idea to promote this as a binational trial, it's a kind of rubbish, right? 9,341,000 Koreans and 6,800 Americans make a binational trial? Hope that helps.